Hello, everyone, and welcome to this webinar. I'm Adrian, and I lead marketing and communications at Neurum Health. Thank you, everyone, for joining this afternoon. Before we dive into our topic today, let me do a little bit of housekeeping first. Please keep your microphone muted throughout the presentation. And if you have any questions or sharing points, please type it in the chat, or we will have a Q&A session towards the end of this presentation. Please note that this webinar is being recorded for marketing purpose. If you have any concern, please reach out to event@neurumhealth.com. So today's webinar is titled Capturing the Opportunity of AI in Mental Health Care. Today, we'll be focusing on 3 key points. Number 1, how Neurum is using AI. Number 2, what are the health outcomes user can expect from using the Neurum Health. And finally, we'll be discussing the role of AI in improving personalized mental health care journey in the future. Without further ado, I'll pass the time to our CTO and co-founder, Caleb.
Thank you, Adrian, and hello, everyone. Welcome and thank you for dialing in for our webinar today. So before we start, a bit about myself. So my name is Caleb, and I'm the CTO and co-founder of Neurum Health. If it's one thing I love, it's building, and I've been building products as a software engineer for the last 10 years. Though a couple years ago, I felt what it was like to almost lose a loved one to suicide. And since then, I personally felt the barriers to getting effective mental health care, and eventually left my job at Bloomberg. But this inspired me to see how technology and AI can be harnessed and applied to help remove barriers in mental health. So I first started doing research at Imperial College London in AI-driven therapeutics, and then eventually co-founding Neurum Health. So a bit about us. So at Neurum Health, we help insurers and companies scale personalized mental health care for every mind's healing and growth. So through our Neurum app, we deliver personalized and precise mental health support using AI, and we help employees feel confident and comfortable caring for their mental health. Our services expand across APAC through our partners, and our vision is to bring mental health care to life, to where we work, live, and play. So today, I'd like to share how AI is transforming the mental health care and reshaping our approach to it, and why AI is well suited to solve some of the challenges in mental health, and how Neurum is using AI to deliver personalized mental health support. So before we dive in, I'm sure you've all been hearing about or even using ChatGPT lately or other forms of generative AI. It's incredible seeing its recent popularity and impacts. But some of you might be asking, what is artificial intelligence? Thought it would be good to before we dive into it, be introducing this and about the different types of AI out there. So broadly speaking, AI is the ability for machines to perform tasks that typically require human intelligence. So these are things like seeing or reasoning or learning or decision-making. And AIs typically rely on, number one, data that they're trained on. And once they've learned on it, they can perform certain tasks. And different AIs generate different outputs like patterns, predictions, and decisions, or in some cases with generative AI, pictures of cats. And the first insight that I'd like to share today is that the use of different AI depends on both the task and problem at hand, and it's designed to solve, and that different use cases demand different forms of AI. So one way to look at this is through interpretability. So this is how easy it is to understand the output that the AI makes. On one hand, you have machine learning models. So generally, these are really good at picking out patterns and making the results explainable. So you can imagine these are really important in the field of healthcare and finance, where not only the output of the decision is important, but also being able to know how the decision was made is just as important. Then there are deep learning models and generative AI models where interpretability is harder. So an output like a response on ChatGPT or a generated picture of a cat, how the model got there and the patterns that it learns is harder to decipher. And in fields where there needs to be governance for output, this might not be as suitable. So within each branch of AI, there is progress. And this is really exciting because as capabilities grow, we can further apply it and combine it to solve bigger problems and tasks. So hopefully you get an overview of this AI landscape. And now I'd like to bring it over to our field in mental health to understand what are some of the problems and barriers in mental health and how we can use AI to solve them today. So mental health is a big problem. In recent studies done, currently across APAC, approximately 1 in 4 employees report mental health challenges. And this is particularly higher in Hong Kong with 27%. And the challenge is that what they need will be different for each person. So McKinsey analyzed that at any point, 75% of employees can benefit from support that fosters mental well-being. 24% will require additional support through counseling or therapy, and 1% will require more intensive treatments. And also, I'd like to note that at any point, people may move back and forth, and the support they need will change based on their ongoing mental health needs. And what's to make this problem harder is that it was found that 74% of those are not seeking any form of professional care. These are employees that are, A, not getting the care they need, second, coping with mental ill health, and additionally, for your company, it's affecting your bottom line through loss of productivity and motivation. But why aren't people getting the care that they need? So let's look at an example. So how it is today. So let's picture Lucy. So she's a new mom and has been feeling drained for a long time, but unsure why. She's unclear what's happening and a little bit confused. It's not just Lucy. This was me at some point, and you can picture yourself or your colleague in this situation. The reality is most people stay at this part of the journey. And at one point, Lucy feels the need and seeks support and care. So she looks around and she asks her family, friends, colleagues, or employer. And during this process, she might be faced with a lot of uncertainty as to what to look for and what support is needed. And in the less often case, Lucy finds professional care and gets treatment. The practitioner may prescribe therapy or medication, and she tries it. And after a while, she checks in to see if it's working. And it might work, but even then, there's a lot of trial and error involved. And throughout this whole process, there's a high drop-off rate. And that's the gap we solve at Neurum. So what are these barriers? So the first is being unsure why. This is because mental health is really hard to understand and quantify. Second of all, not knowing what you can do about it and not knowing what resources are right for you. And third, it's really hard to track and measure progress. So at Neurum, what we're doing is we're building AI that can learn about behavioral health risk and help individuals navigate these barriers. So our AI enables us to first identify patterns. So Lucy can start learning why she's feeling drained. Second, we can personalize care suggestions so that when she's in need, she can get recommended tailored care based on their individual characteristic and needs. So she doesn't have to feel as uncertain in it. And lastly, we can track and forecast your mental health. So Lucy can use it to see how she's progressing and stay motivated. So next up is, how does it work? So first, we collect data about you through our digital platform via screening tools, wearables, sensor-based data, and even your environment, like the weather. We then extract signals. So this is known as feature extraction to know about your behaviors, thoughts, feelings, environment, and characteristics. We then use machine learning models and we train it on that data. And it learns what defines and drives behavioral health risk from this data. What we get is an AI that can both predict risk and also identify what is driving it. So for example, with the AI, you can get screening of your mental health and then get personalized insights and suggestions based on what's affecting it. You know, things like your sleep schedule or weather or your lifestyle. So what does this mean for Lucy? Our AI closes the gap and makes sure that when she needs it, she can find the right care. So instead of, when she's feeling drained and instead of not knowing why or feeling unsure, she can start to learn why and understand what's happening and what she can do about it. So she's more open to seek support and next steps. So with our predictive analytics, we can offer we offer screening into your mental health and can highlight patterns that are affecting you. So this covers things like behaviors and the environment. And our AI highlights the ones that are affecting you the most. So for example, for Lucy, she can learn more about her anxiety and that her maybe sleep schedule is really affecting her. So what we've seen is when users are more aware of their mental health, they are more likely to seek support. And providing this learning drives the adoption of next steps. So on our platform today, 80% of recommendations made are actioned on. So once Lucy has understand what's happening, she can immediately get relevant care that's suited for her. So there's less guesswork and barriers. So on the Neurum app, using the AI, we tailor self-help resources and suggestions to our human care network based on their individual needs and characteristics. So with the platform, Lucy can get resources to help her sleep and practices to better manage her anxiety and also get connected to relevant therapists for her. So not only does she get the right connection, but there are actionable resources and tools that she can practice anytime, anywhere on the platform. So through our recent validation study, we've also seen that when employees use our digital interventions, which are the tools and programs on the platform, out of 100, 95 of them reported that it not only helped their general well-being, but their feelings of motivation and productivity. And finally, in this journey, we know that keeping motivation is hard. With our AI, we can help visualize the progress, so Lucy is confident throughout the journey. Our AI forecasts and tracks your mental health over time, so Lucy not only sees how she's progressing, but also gets timely nudges. So we can see how AI is being used today to close the gap to finding the right care. For Lucy, this means less time and effort finding the right support and more time on her healing and growing. And AI definitely has many opportunities and benefits, but I'd also like to take this opportunity to highlight the risk considerations when applying it in the mental health space. So the first is interpretability and explainability. So there's a difference between having ChatGPT, which is trained on a corpus of public data, as opposed to data sets that are scientifically measured and with validated care modalities. So, releasing models that give advice, we have to make sure that it's not harmful and is science-backed. So it's really important in this space to develop AI models that are trained on credible and research-backed data, so we can ensure quality and safety built in. So at Neurum, our data set and care modalities are all science-backed, and we make sure that it's not just based on research, but we also run our own as well through validation studies and randomized control trials. The second is governance. So we need to be cautious of how risk is managed and that there are robust procedures in detecting and escalating risk when the level of care is not sufficient. This is why it is important to be able to know a model's decision. This is why it's important to know how a model's decision was made so that we can reliably ensure that there's proper governance in place and know when to escalate. So at Neurum, we ensure interpretability is prioritized so that we have robust checks in place and that the handoffs to appropriate care is there when needed. And this is only just the beginning. Today, we learned how AI is used to help individuals access, find, and adopt the right mental health care for them. And to conclude, as the field develops and we get more capabilities of AI, and we push the bounds of artificial intelligence, we're dedicated to harness and further close the gap in mental health care. So not just for individuals, but for companies and for insurers and the wider value chain, to provide truly accessible mental health care by unlocking a future that is predictive, proactive, and effective. And so if you would like to find out more about how Neurum can help your organization, please do feel free to reach out after this webinar and book a demo with us. And thank you for listening, and I hope you found this valuable. And I'm looking forward to hear your thoughts and any questions you might have in how AI is used in the mental health space. Thank you.
Thank you very much, Caleb. We have a few questions coming in. So we'll give a little bit of moments for our audience to collect their thoughts and share. You may share your questions in the chat box, or actually you can send it to Pigeonhole Live, which is an anonymous question platform. But before that, Caleb, can you share a little bit more about what are the benefits that organizations can expect when they roll out or implement Neurum Health to their employees?
Yeah, I think for us, the value of Neurum is being able to scalably provide personalized mental health care. So, right now in your organization, there are those who do need the care, but might not be finding the appropriate care. And so you might be losing out on, that individual, obviously not getting the support that they need, but also affecting your bottom line. So these would be loss in productivity. So what we do at Neurum is we help engage employees and making sure that they find the right care. And what this means is we see healthier outcomes, but we also see, increases in productivity and motivation. And those are the things that we can provide for companies.
Another question, it's about, could you elaborate more on how you use scientific data sets to improve accuracy, as ChatGPT alone hallucinated a lot?
So that's a really good question. And that's why I, stress one of the things to highlight about the risk of AI are things like hallucinations, or, why we need to know why interpretability is so important. Because you need to know, especially in mental health care, that when advice is given, that it's based on credible and, safe and not harmful advice. So how we solve this at Neurum is we make sure that when we do feature engineering and when we are putting together these care modalities, that we first base it on research and make sure that every single data point that is trained on is something that is validated to make sure that we're not introducing any harmful hallucinations or any form of so we can also interpret the results. So this is how we make sure that the outputs of our model is something that can be trusted and credible. Oops, sorry.
Another question from Pigeonhole is that how do companies overcome the trust on AI for mental health?
How do companies? So yeah, that's a good question. I think trust is several factors. So how we see it at Neurum is several folds. So obviously we have doing everything we can from a technical perspective to make sure that both employers and employees can trust Neurum. So for example, we take data privacy really seriously, making sure that, all data is anonymized and is non-identifiable. So making sure that the employees feel safe using Neurum. Yeah, so that's one way. And second, apart from our product, we also help employers, with the rollout strategy, making sure that, when we are introduced, that employees do see this as a mutual benefit for everyone.
Thank you very much, and we'll see if there's any other questions coming in. If you have any questions for Caleb about how we use AI, or how AI will be useful for mental health care in the future, feel free to share your questions with us. If you'd like to submit it on Pigeonhole, please feel free to do so. There is a question about how do AI increase the stickiness and consistency for users?
Yeah, that's a really good question, and that's something we've seen. So there are a couple of things that AI enables. So not just AI, but just technology in general. So as I mentioned today, one of the biggest barriers is not knowing, progress. It's really hard to see. So I always take it to the example of physical health. Like if you're going to the gym, it's good, but sometimes it's really hard to see if you're going in the right track. And with things like weights and measurements, you can start to see like ways of measuring progress. So similarly, what AI and technology does in the mental health space is to provide different measures to know if you're progressing towards. So things like, it might measure your symptoms of stress, anxiety, depression. So these things are trackable, and what AI and technology does is it gives you a very great way to visualize it. So that's one way that we, keep people motivated. If they can see the impact of the work that they do, that's one way we keep people encouraged and motivated to continue.
Great. I hope that provides some clarity for our audience. I see that one of our audience is typing, so we'll give that question a little bit more time. But if you have any interest in exploring more details about the Neurum Health, or even just Neurum Health as a company, please feel free to reach out to us. You can email us at hello@neurumhealth.com or event@neurumhealth.com. Our team will get back to you as soon as we see your message. We shall give another 1 or 2 minutes to our audience. If you have any questions, feel free. We designed this webinar to foster open conversations around our company and our audience as well. Or if you have any questions about implementing the Neurum Health app in your organization, feel free to ask here as well. And if you are, just before that question kicks in, if you're looking for any useful information about implementing a mental health app in your organization, please feel free to head to our website. Under resources or news, we do have a lot of useful content for you to reference. Right, if there is no more questions for Caleb, we'll wrap this webinar up. Thank you very much for attending and spending time with us. As always, if you have any questions or even not just about this webinar, or you would like to know more about the Neurum app, feel free to reach out to our team. We'll get back to you as soon as possible. Again, thank you very much for joining us.
Yeah, thank you, everyone.